IBM says it is moving more than 100,000 retirees off its company-sponsored health plan. Instead, Big Blue will give them money to buy coverage from a health insurance exchange. And IBM isn't alone. Media giant Time Warner is now planning its own changes to retirees' health care. CBS News contributor and analyst Melody Hobson is with us from Irvine, California. Melody, good morning.
Good morning.
All right, so what is IBM doing, and is this now going to be a trend?
Well, first of all, I absolutely think it's going to be a trend. And what they're doing is they're taking their retirees off of their employer-sponsored health care plan. They're giving them a set amount of money, an annual contribution, and they're allowing them to go to a private insurance exchange. The idea here is that they wanted to make sure that they could stabilize costs for retirees, not even cut them, because they anticipate that by 2020, the health care costs will triple from what the retirees are paying right now.
So is this in reaction to the president's Affordable Care Act, otherwise known as Obamacare?
Not in reaction, but certainly in reaction to the escalating healthcare costs that the president has talked about, which is why the Affordable Care Act is happening. They're seeing these costs escalate, and they're saying it actually is not going to help IBM per se, because they've limited the amount that they contribute to retiree healthcare 2 decades ago. They allow a cost of living adjustment, but they're really saying the retirees are going to be in trouble here.
Melody, I understand why companies are doing this, and about 300 so far have done this. But if you're a retiree, is this good or bad news?
I would say in the short term, it's probably neutral. And the reason that I say that is IBM is saying the healthcare coverage should be as good or better than what they're currently getting, because they'll have more choice. Now, over the long term, and there's a big if on this, if it works, the healthcare costs should come down. And the reason that I say if, for this to work, you need to get young people into these exchanges in order to offset the older people who use more healthcare services.
But Melody, you know, most retirees at home are hearing this and saying, all right, this is my former company that I worked decades for is screwing me.
I don't think that's actually the case. I think what the evidence has shown is when this is explained to them, they get pretty comfortable. It's not really a situation where they're worse off. They just now have control. It reminds me very much of what happened with pensions. We went from a situation where companies would manage your retirement money for you, and then they moved to a defined contribution plan where they give you a set amount, and then you make the decisions. We're seeing the exact same thing happen right now. It's not necessarily good or bad. It's just different.
We're seeing it change, certainly the healthcare landscape. Melody Hobson, good to see you. Thank you so much.
Thanks.